Okay, top tips for a midwife attending a hypnobirth. I think the absolute top tip is that there's not much difference between a hypnobirth and any other normal natural childbirth. So anything that you would already do, you just do again. Calm, quiet, peaceful environment, keeping mum as relaxed as possible. A lot of midwives talk about hypnobirths as being very similar to a water birth, in the sense that it has that calm serenity around it. A few things you might find at hypnobirth. Firstly, is the couple might ask that you don't actually actively talk to the mother or engage the labouring woman. Because, of course, when you make conversation with a woman who's in labour, is that you might be taking her out of that zone that she's getting herself into. She's getting herself into a relaxed, calm zone. When she has to answer a question, no matter how mundane it is, she comes out of that zone. So we say that mom gets left on her own in her zone. The birthing companion might be supporting her in that, but it's really useful if the questions can be addressed to the birthing companion, because then he or she can do all the thinking and the talking and the deciding, and she just doesn't have to do any of that. She can just get on and labour and have her baby. It's a really nice way, I think, of enabling normal birth. Of course, there might be an issue with consent and needing to gain mum's consent for something. And hypnobirthing couples understand that if it's absolutely necessary to gain her consent, of course you're going to do that. And that's fine. She can come out of her zone and go back in. But it's wonderful if that doesn't have to happen. And some couples might even ask you to do that outside of the room. So if there is anything you need to tell or mention, just kind of step out of the room with the dad or the birthing companion and have that conversation in the corridor while she gets on with labouring, either in the pool or wherever she is. Another thing with hypnobirthing is that if they've done the Marie Mongan method, the couples will have been taught that forced pushing isn't the best way to get a baby down. So we teach more kind of gentle and natural methods, allowing the muscles to do the work themselves. We teach mums breathing techniques which help bring the baby down. We call it bearing down or breathing down. So the mum will have been practicing for many months, every time she's on the toilet, a way of helping the muscles do their job and let the baby come down and out. There's a kind of opening sensation to this technique as opposed to a kind of tensing up sensation to this technique. So you might find that the couples have put on their birth plan that they don't want to be holding their breath pushing or force pushing or Valsalva pushing. Other than that, it's just a normal natural birth. Your calmness, your quietness will be much appreciated, even if mum's chatting her whole way through.